My name is Louise Adams. In December of 2018, I was diagnosed with breast cancer. I went for my regular routine yearly exam, and I was called back in to have it redone. And when I went back in, they referred me for a biopsy because of increased calcification from the previous year. I was diagnosed with ductal carcinoma in situ, and that is breast cancer of the milk ducts.
My name is Dr. Benjamin Eskra, and I'm a plastic surgeon at Eskra Plastic Surgery. We have an office in Kinston, North Carolina, as well as Goldsboro, North Carolina. So Louise is a great patient. She had developed a breast cancer and was planning to have a mastectomy, and finally I think she had found the mastectomy surgeon that she was most interested in, and then she wanted to put all the pieces together with the reconstruction. So, you know, when she met with me, I remember specifically her saying, "This is it. I'm so glad that I didn't rush into surgery before. I feel like I found the right fit." And she really came in very educated, and so she asked a lot of great questions. She was making sure that she was getting what she wanted and that I was really dialed into what she was looking for.
I will forever be grateful for the level of professionalism and care that I received during my entire journey, from the diagnosis right up to my final visit with Dr. Eskra, which was bittersweet. Had I not been on top of my yearly mammograms, I don't feel that my diagnosis would have been as it was. I feel it would have been a more advanced stage, and because I actually went for my yearly mammograms on a regular basis, it was the earliest possible stage, and it was non-invasive.
I encourage all women, especially women that have any family history of breast cancer, to really, making sure that you're doing your self-exams and making sure you're getting your regular visits with your doctor and making appropriate decisions about the timing and frequency of mammograms. And I think it's, it's important for all of women's health.
I would definitely recommend Dr. Eskra to friends, family, the world. He is awesome. He is, to me, the best. I am 100% satisfied with the surgeries that he performed on me, as well as his bedside manner, his compassion, his concern, and I would highly recommend him to family, friends, loved ones. It doesn't matter. I would recommend him to anyone.
For some of my newly diagnosed breast cancer patients, I wish a patient like Louise was sitting right next to me when we were having that initial consultation, because then they could get the opportunity to see what it's like to have a life after breast cancer. And once we've done that reconstruction and we've restored what that breast cancer takes away, and to have somebody like Louise to be able to say, when you're done with this, everything will be great. You will feel, in some ways, can be better than ever, because you know that you've beaten something that has challenged you, and you've come back and it's been reconstructed, and get back to your life and get back to your family and feel better than you ever imagined that you could after such a difficult diagnosis.
I'm just grateful that my journey was such that I'm able to share it in such a positive way, because I have no negatives from beginning to end, from the diagnosis to the very last visit. That's my journey. That's it. And I would not trade it for the world.